A local woman credits skin cancer specialists at Mercy Health with allowing her to have her skin cancer removed before it spread. She shares her story today with medical reporter Liz Bonus to remind all of us just how important it is to protect our skin, especially in our younger years. Details in today's Medical Edge.
Think about this as you soak up the sun this summer, especially if you have young children. A report just released from the American Association of Cancer Research says as few as 5 blistering sunburns before age 20 can up the odds of the most deadly form of skin cancer, or melanoma, by up to 80%. Nanette Bentley says she is proof this may be true.
I grew up in Southern California, and I'm of that age where we just did not have awareness of sunscreen and the dangers of the sun at that time. So unfortunately, I'm fair and I burned plenty.
Nanette's skin cancer turned out not to be the deadly kind. It's what's called a basal cell carcinoma. It's more of a surface skin cancer that doesn't usually penetrate the skin and go to other organs. But Dr. Emily Fisher says it's still important to remove it.
I've seen some basal cells take off someone's ear completely, take over their nose completely, so that's, of course, the worst case scenario.
Nanette let us in on her skin cancer removal to remind all of us about the importance of sun protection and that you need to have suspicious moles checked out.
I'd felt a little bump on the side of my nose, and it didn't go away.
After tests confirmed it was skin cancer, Nanette consulted Dr. Emily Fisher. She specializes in what's called a Mohs procedure to remove it.
It's a type of procedure used to treat primarily non-melanoma skin cancers.
Here's how it works. Nanette stays awake through the whole procedure. The area is numbed with an injection, and then the first layer of the cells are removed. These cells are then taken to the lab right next to her procedure room because she's in what's called a Mohs surgery center.
I'm looking for any remnants of skin cancer that are still left. That could be a few cells. It could be a great majority of the cells that are still positive for skin cancer. But it all tells me under the microscope what's still there.
What makes this procedure unique, however, is that they continue to do that until they get all of those cells removed, and they can see that in the laboratory. It is important for the patient then to be able to know that those cells have been removed, and the cure rate is higher than 99%.
The great thing about this is because we map it, so to speak, I can go just where the skin cancer is still positive. So I don't need to take any tissue unnecessarily.
Nanette had all of her cancerous cells removed on the first take, so the area was then repaired and a few stitches were put in until it heals.
I'm happy it's something treatable and not something more serious. I feel lucky.
So lucky, she says, she's not going anywhere these days without sunscreen. At the Mercy Health Physicians Kenwood Mohs Surgery Center, Liz Bonus, Local 12 News.
If you would like details about this procedure, we have a link to the Mercy Health Surgery Center at local12.com. Just click on the Get It button.